So we are going to look through a case management file with the assumption that the client has been seen and the data has been entered. Then we are going to look at the scenario in the event where the client comes to the clinic and the client has no record on the system. Then we are going to work from there. So today we have a first case. I will walk through case 1 and I will let you walk through case 2. We are going to have presentation from participants for case 2, and we have Dr. Judy Nisbet from St. Kitts and Nevis doing case 2 for us. And that way we can assess the level of understanding from all we've done so far. And I will start. So case 1 is about Susan. She is a 43 years old Hispanic female who presents with fever of 103 Fahrenheit, non-productive cough with dyspnea, which has progressed for 5 days. She was diagnosed with HIV on 2nd of January 2015 and was registered into care. She was placed on AZT of 200 milligram orally for 3 times daily. And after her first clinical management visit, she was lost to follow up and never again showed up at the clinic until today. So a little background about Susan is that she uses injection drugs. She has no history of tobacco or alcohol use. She has no known allergies to drugs. She was born in Mexico and she lives in your current country. Her highest level of education is secondary and she is a sex worker. She has greater than 10 sexual partners and she has said that the types of sexual activities is vaginal, anal, and oral. She rarely uses condoms and she has sex without disclosing HIV status. On physical examination, she was pale, diaphoretic, acute respiratory distress. Her temperature was 103 Fahrenheit, pulse 96, respiratory rate 30, and a systolic blood pressure of 110 and diastolic 70. She has a 99-pound weight and oral thrush. She has bacillar crackles and tachycardia, but no murmur, and her abdomen is not tender. The lab evaluation revealed that HB of 7, WBC of 4,300 cells per cubic meter, and then LIMS 41, monos 9, SO6, PASOS 1, platelets 250, CD4 11%, viral load 280,000 copies per mil. Sputum was induced and the direct fluorescence was positive for PCP. The treatment she was given on day 1, she was hospitalized and she was given IV Bactrim at 20 milligram per kg and 100 milligram per kg respectively per day, and prednisone for 40 milligram twice daily. We are going to walk up until day 1, and during your practice, you can go on to day 3. On day 3, she improved and she had a respiratory rate of 18 and oxygen saturation of 98%. And on day 4, she relapsed with a fever of 102, elevated AST, ALT, alkaline phosphatase, and she had fine rash, like meso-like rash, distributed over her trunk. And then you will continue and decide the treatment outcome. So I'm going to work with case 1. We are going to start with the assumption that this is the end of the clinic day, and that case has been entered into the system. Or we are going to assume that this is day 5 or day 3, and we want to review what was done on the first day when she arrived or when she was hospitalized. Yesterday, we looked at how to do the clinical management data entry on the system, but we did not look at how to review past case notes. So I have a case note that was pre-filled, and I'm going to demonstrate how to review the case note before you see the patient for new recordings. On the pages menu on the left, you will find the clinical management submenu. When you expand this submenu, you will go to previous encounter, enter in the unique ID of a client that is registered on the system and has record entered, and click on previous encounter. This gives you the previous symptom review, the previous CD4 and viral load, the previous clinical staging, and the mental health assessment report that was recorded. It gives you series of encounters in different boxes. So we have just one recorded for symptom review. In the event that she has more than one, you will find a second container with the heading has the dates and timestamp when that recording was done. So you will have multiples with the most recent first. So you can review as much as you want and review all of the case notes of the client from several years. So this was pre-entered with the what we discussed from the case scenario. We have the CD4 and viral load values from the lab already entered. We have the first values, we have the recent value, we have the clinical staging, and we have the mental health assessment. So in the events where you are the doctor on call now and you did not see this client yesterday, but today you are going to see this client for whatever reason, you want to review the previous encounter before you start. So this is how you do that. You come here to previous encounter, enter the unique ID, and review the past note that was recorded by the previous doctor. Let's go back to the case scenario, and let us assume that Susan came to the hospital when paper record was used. And at the time she showed up, she doesn't have a record on the system. But you want to put her record on the system so that you can continue clinical management on the system. The scenario says that she's 43 years old, which means that she was born in 1979, if I'm not wrong. She's Hispanic. She was born in Mexico and she lives in our current country. So we are going to create an account for her. Now, this account we are creating does not relate to the job functionality of clinical management. But because we have the clinical care team and we have the clinical care nurse, I'm trying to demonstrate what happens in the event a client comes. You are determined to use the system and you don't want to go paper-based, and the clients do not have a record on the system. So let's start. You come to Pages menu, and somebody with the general population counseling and testing permission will create new client account. We are creating the account today. And the contact of reporter, like we said, is going to be your contact, office number, personal number, anything that your supervisor can reach you on when the data entry is reviewed and there is a data entry error and they want you to correct it. So I assume this is my contact number. The facility type will be other. This is a public hospital. The name of the client is Susan. I will make up a last name for Susan. Her last name is going to be Ndo. Her date of birth, I'll give her any day, any month, and the year of birth is 1979. She is a biological female. Her mother's maiden name, she tells me, is Solomon. I have her testing code automatically generated. So I want to give a unique ID. So SD00122. And I will assume this is a social security number. Once I create the account, I will come here to request release of client's file. I will enter the date of record access, which is today, the unique ID, which was ST100122. We're going to record our HIV screenings, our TB screening, and other STI screenings. And I will click on submit. When I do this, I will come here to collect information, enter the unique ID again, ST00122. Now, like we discussed in previous weeks, we have the basic summary and the important behavioral summary. This is going to be populated when we collect her information. If you do not have time to enter this record now, you just want to go to clinical management, you can do the referral, clinical management, and come back to update. But if you have the time, you can now fill in the personal information. But the whole idea is to create the account, refer, register into care so that you can enter the records for today. Her date of birth is already there. Her country of birth, we said, was Mexico. Her country of residence, I'm going to assume that I am in, let's use A, Antigua. Her address here is and the town is, let's say, St. John. The health center, let's put any health center here. I'll select St. Joseph. The parish, I'll select any parish. The length of time in country of screenings. So she has spent 19 years in Antigua. Her gender identity is female. Her sexual orientation is heterosexual. She doesn't give us her telephone number, but she said she is single. Her ethnicity is Hispanic. Her occupation is, she said she's a sex worker. So being a sex worker is self-employed, right? Highest level of education is secondary. Number of sexual partners, she says she has greater than 10, so we'll put 10 to 20. Type of sexual activity, vaginal, oral, anal. She is not pregnant. We don't know if her regular sexual partners have been tested. She is alive. The cause of death is not applicable, and she has lived in another country. So we save this. We want to look at her risk behaviors also. So again, I'm filling this in to see the total clinic flow from registration up onto clinical management and then later up onto death. But you don't have to fill this in on a clinic day. You just have to create the account and register into care so that you can collect or record the clinical management notes. The date of report here is today. She has had sex with males in the last 12 months. She has had sex with females in the last 12 months. She has had sex with persons of known positive HIV status. She says never. Had sex with sex workers. She said never. She says she always has transactional sex. She has shared needles while injecting non-prescription drugs. She uses illicit drugs. She has sex under the influence of alcohol. We say never because she says she doesn't take alcohol, but she has sex under the influence of drugs. So in the last 12 months, she has had sex with multiple partners in the last 12 months. She doesn't have perinatal exposure to HIV. She said she received a transfusion of blood over 12 months ago. She doesn't have occupational exposure while working in a healthcare setting, laboratory, or providing safety or emergency services. Never. Being a victim of sexual assault over 12 months ago, she has never received any transplant. At the time of HIV testing, we asked her and we do not know this information. We do not know if she had TB at the time of HIV testing. We do not know if she had contact with confirmed TB. This is for TB patients who are not applicable. She says she rarely uses condom. She has never been incarcerated. She has been homeless, but over 12 months ago. She is a sex worker in the last 12 months, and she said she has had sex with transgender female with prior knowledge in the last 12 months, and will save her risk behaviors. So notice that after we fill in the personal information and the risk factors, we have our basic summary and behavioral summary populated. Then we are going to look at risk reduction plan in the coming days, what we are going to do with this information. So we'll go straight to HIV screenings. And the scenario said that she was diagnosed with HIV. It gave us the date of her diagnosis. So let's see that, 2nd of January, 2015. So let's go back there. So she had HIV screening on the, let's say, 1st of January, 2015. And what she had then was a confirmatory test. So sorry, second. And the result was positive. So we are filling in the results so that we can move on to refer her. Sorry, this is 2nd day of January, 2015. So if you have the history on paper, you have the day she was diagnosed and the day she was referred, you will put this. So she had a ELISA-based test, and I'll save this. So that's the only information we have. We do not have information of syphilis and TB. So I'll save this. I'll come back to pages, go to referral, refer new HIV case for registration and management. So the date of referral here is going to be the same date, 2nd of January, 2015. And the unique ID that we had was ST00122. The category is adult, and we'll refer. After referral, her file is transferred to the STI or ID clinic. You'll now come to care registrations and initial evaluation. You will click on view HIV care referrals, and then we have that unique ID of somebody who has been referred. She's available today at the clinic, and so we are going to assume she was registered into care at the time of referral. So we're going to register her now. Put in the unique ID and put in the date of registration, which is, so we'll assume she came 2 days after, January 2015. So you are backdating the record based on what you have. So she's now in care on the system. We want to go on to record her initial evaluation. For that, you come to care registrations and initial evaluation. You come now to adult, pregnant, and adolescent initial and clinical evaluation. Sorry, I'm rushing over this because we've done it before and it's not the focus for today. So we have her here, her current age. If she was registered into care in 2015, this should be like 7 years ago, right? And 7 years ago, she was 35 or 36 years old. So death confirmed positive was 2nd of January, 2015. The date of enrollment into care was 4th of January, 2015. The age at enrollment was 36. So prior art, we are filling this in that she has earlier ARV exposure, but not transfer in. The regimen she had, according to the scenario, was AZT, and they were giving her, let's see, her earlier ARV exposure. So AZT was 200 milligram orally for three times daily. And the date she was given this was on the same 4th of January, 2015. And the care entry point was inpatient. We have the baseline information that she started out on the same day she was registered into care, 2015. Her initial weight, let's assume she weighed 220 pounds initially, and her initial clinical stage was stage 1. She did not provide any of this. We have information about her drug allergy. She has no known allergy to drugs. So we'll put the date of clinical stage. So the date of first stage 1 clinical staging was 4th of January, 2015. So let's see, did we have initial CD4 value? So we don't have the initial CD4. So I'm going to skip that. And we don't have initial viral load information. Once this is done, now you come back to appointments and patient monitoring and schedule clinical management appointments for her. And the reason for appointment is HIV clinical management, and we want this to be done today. So now I have showed you all the process to start up a client who comes in with a paper and does not have an account on the system. In the event you have enough time and you do not want to record her data on paper, you want to do it directly on the system. So this is all you will do. You will create the account, you will record the first positive test that the client had, you will refer the clients. You're going to backdate all those records to those dates and fill in as much information as you have. Register the client into care, record the initial evaluation, give an appointment. So now we are going to start from where you start from when the record is already on the system. Once the appointment is successfully created and the client is present, we come to create visit or record vital signs. Put in the unique ID and start visit. So now we are going to record her vital signs. Let's see what the case scenario says her signs are. So we have the signs for the temperature, the pulse, respiratory rates, and the blood pressure. So let's enter this. I'll write it out so I can easily enter it without switching screens. Okay. So we have the temperature of 103 Fahrenheit and convert to Celsius there. Her blood pressure is 110/70. Her pulse is 96. Her respiratory rate is 30. Her weight now is 99 pounds. Her height, let's say she has a height of 170 cm and her BMI is 15.6, calculated automatically. We are going to send this. Once this has been recorded, now the clinical care coordinator or the doctor can come to clinical management and see that unique ID on the list of waiting clients. So because this client is ready to be seen, the doctor can come here and come to, the purpose of visit is HIV clinical care. And now you come to HIV care card to retrieve the care card and now start recording information for today's session. Let's go to the case scenario again. So today, she is pale, she is diaphoretic, she has acute respiratory distress. We have recorded the vital signs. She also has oral thrush on physical examination, basilar crackles and trachycardia but no murmurs, and she doesn't have any tender abdomen. And then the doctor is going to request lab and get the results for HB, WBC, platelet, CD4 viral load, and then do a sputum culture. And then we will do the treatment for day one. So to follow that story, when you come to the page, you see the flag that CD4 and viral load test has never been done for this client. We have the BMI trend, but we only have the BMI for today. No adherence assessment reports recorded on the system. We do not have any results for HIV drug resistance. We have the vital signs already taken. You can choose to repeat the vital signs or go to the next tab for symptom review. So today's date is 16th of February, 2022. She says that she is coughing. She is sweating excessively, perspiring excessively. So cough, so let's write fever, cough, sweat, unintended weight loss, yeah, shortness of breath. So we've written what she's complaining about. So on physical exam, we have the clinical findings here to be she's pale, she's diaphoretic. So we can see her sweating excessively. She has, so let's say we repeated the vital signs and her respiratory rate is, her pulse is over 100. So she has respiratory distress. She also has oral thrush on examination. She has a sound on her lungs, so vascular ripples. She also, let's put this for her heart rate. And then non-tender abdomen. So what are the problems we see? She has oral thrush. We are assuming she might have a pneumonia that is not TB. She has fever, she has cough, she has wasting and significant unintended weight loss. Her family planning, she says that she uses oral contraceptive pills. This is not applicable. We think that she's symptomatic and she might have opportunistic infection. We want to do, the plan is lab evaluation. We want to also hospitalize and do some symptomatic treatment of pain control, adherence counseling so that she comes back when she gets well, and we'll stop here. The ARV therapy, we're going to restart treatment, and we're assuming that we might be giving this for the treatment. But once they had to be hospitalized, and it says that the first medication is this. So let's say we're giving IV Bactrim. We have 20 milligram of, so it's 2000, right? Per kg, per day. So they'll calculate what they're giving her. And then you give prednisone, 40 milligram. So once you write this, do the symptom review and your plan, you will save this. The next thing you want to record is a TB symptom check. Today's date is 16th of February, 2022. She has been coughing for more than 3 weeks. No, she just said she started 5 days ago. She has fever. She is not coughing up blood. She doesn't have excessive night sweat, but she's sweating excessively all the time. She does not have any harshness. She doesn't have any, she has mild chest pain. She is fatigued. She has loss of appetite. She has unexplained weight loss. So has this client been previously diagnosed or treated for TB? She says no. Has the client been in contact with someone that is known to have long-standing cough? She says no. So we are suspecting TB and want to screen for TB. We're going to refer for AFB, refer for chest X-ray, refer for TB treatment or prophylaxis, and she's going to be on TPT and CPT. Sorry, TPT. So I'm going to change that for that error, but you get the idea. I will not refill this anymore, but the data is already saved, but just give me an error warning for this. We want to update the CD4 and viral load values. And we say that the labs returned with a CD4 of 235 cells per millimeter cube. So put CD4 235, and the viral load was 280,000 copies per mil. And the date is today. And I will click on save. Now we want to look at the clinical staging. We have unexplained severe weight loss. We have unexplained persistent fever, but it's not longer than a month, just 5 days. She has oral candidiasis. She has oral thrush. So I'm not sure whether to fill this in. So let me assume I'll fill this in. And then she has unexplained anemia because I think her HB was 7. And then we will save. So she's in stage 3. Fill in the date. And save. You want to choose when to do this. You want to do this later when you are updating case notes. Like I noticed in some hospitals, there are some information that they update later in the day before the doctor closes when they fill in files. And not necessarily do that at that point. But if you have enough time and you want to do that, you can go forward to do the drug reaction to see if she's reacting to any medication. She's not on any medication, so we're going to leave this blank. But we'll fill in the mental health assessment or evaluation. Today is 16th of February, 2022. She has not been incarcerated in the past 90 days. She's not on any medication for now. She's starting today. She said she has had unprotected sex in the last 90 days. She has used cocaine in the last 90 days, and she has also had sex without disclosing HIV status. We want to do the assessment before we do a category of mental disorder. We want to say for depression and ask her that in the past 2 weeks, has she had little pleasure in doing things, or has she felt down, depressed, or hopeless? She says not at all. So the highest domain score is 0. Has she felt more irritated, grouchy, or angry than usual? She said no, and highest domain score is 0. Has she slept less than usual but still have a lot of energy, or has she started lots more projects than usual or doing riskier things than usual? She says no. Has she felt anxious, nervous, frightened, worried, or on edge? Has she felt panic or was unusually frightened or avoided situations that made her anxious? She says no to all. Has she experienced a traumatic events or attempted to avoid distressing memories? She says no to all. Has she had thoughts of hurting herself? She says no, she loves her life. Has she heard things other people couldn't hear, or has she felt someone could hear her thoughts? She says no to all. Has she had problem with sleep that affected the quality of her sleep? She says yes. In the past 2 weeks, she has had difficulty sleeping almost all the time. Has she had problems with memory, learning new information, or with location? She says she started having that for the past several days. Has she had unpleasant thoughts, urges, or images that repeatedly enter her mind, or felt driven to perform certain behaviors or mental acts over and over? She says no. Has she felt that people treated her differently because of her HIV status, and has she felt out of place in society? She says that only herself and her God knows she's HIV positive, so no. Has she had any situation where she doesn't know who she was, or not felt close to other people, or enjoyed her relationship with them? She said she has not felt that in the past 2 weeks. Has she drank at least 4 drinks of any kind of alcohol in a single day, used any medicines on her own, or engaged in sexual activity to numb painful memories? She says yes. So the highest domain score here is 4. Has she felt guilt or shame either before or after engaging in sexual activity? She says all the time. And as she has a detached feeling from herself or body or physical surroundings, she says she just started feeling that. And then you, based on the highest domain score, you might want to put an intervention for sexual behaviors and dissociation. And you are done with data record for now until you are going back for another word round to see this client and enter information. But for the sake of the pharmacy and the nurses on the ward, you want to fill in the treatment. The treatment form has the date confirmed positive and the result. The client has never been screened for syphilis or tuberculosis, but that had tuberculosis symptomatic check. The treatment you want to give, that is an ARV or TB medication, you are giving this. You are giving, this is first line, right? The dose is going to be this, and the duration, let's start 30 days. You want to put her on isoniazid, and it is first line. And what will be the dose for this? Let's say 2 tablets once daily. This might not be correct. We want to start 30 days, and then we will save. So you know, when you come back to our case notes, what treatment that for HIV and TB she is on, so that when she's discharged and for subsequent follow-up, you know what her medication is. You can do a drug resistance test, so you can see how she is performing based on this. But every other plan you have goes on the symptom review so you enter all of your plan plus the medications that are not ART or TB there. But the reason why you enter treatment for HIV and TB is because you want that treatment to continue even when she's out of the hospital. Do we have any questions? Any questions? Should I repeat?
Hold on. No questions for me right now, like Mildred. Like what one of my colleagues was saying is that when we actually start doing it at our sites, we'll probably get a more hands on experience and jot down any challenges or comments that we have at that time.
Okay. So I put the case scenario in the chat for your private use if you want to follow the story and follow an information. But for now, before I hand over to Dr. Nisbet, I'm going to show you how to review the previous encounter for this client. So let's assume that this is now day 2, and you're coming in on day 2 to follow up with the client, assuming that the doctor who saw the client is out on sick leave the next day. So you have the symptom review that was filled in, the CD4 and viral load, the clinical staging, the mental health assessment report. So you can use this now to update yourself before going in for the ward round or whatever, and know what additional treatment to continue with the clients. So we'll move to case 2, and I am going to hand over now to Dr. Nisbet from NIBIS, St. Kitts NIBIS, to demonstrate her understanding of the system. And then if we have more time, any other person can volunteer to demonstrate any case on the system. For this demonstration, we have already a client who has an appointment for today, and we'll use the unique ID AND211. I'll put it on the chat for you, Dr. Nisbet, to work with. So you will start from vital signs and taking the care card. So I will stop share and I will hand over to you. Yeah, Dr. Nisbet, are you there?
Yes, Mildred, I'm here.
Okay. So I just put the unique ID you will use in the chat, and you have the case scenario in the chat also for case 2. So you can share your screen and start.
Is my screen up?
Yes.
Okay. All right, let's see if I can do this, Mildred. Okay.
Do you have the case open, case 2?
Yes.
Okay.
So I should read the case first, right?
Yes, you can read the case first. Yeah.
Okay, so Andrew is a 25-year-old male inmate diagnosed with HIV and PCP on 24th August 2019 with a baseline CD4 of 45 cells per millimeter cube. Viral load is 300,000 copies per mil, 130 pounds weight. He's afebrile. He was afebrile at that time with normal blood pressure. He presents today with loose stool, abdominal cramp, sweats, fever, loss of appetite, and a 12-pound weight loss over the last 4 weeks. Temporal wasting, abdominal tenderness, lymphadenopathy, and peripheral edema. The current medication, and he claims to be adherent, is Combivir, 1 tablet twice a day, Nelfinavir, 1,000 milligrams 3 times a day, and Bactrim for secondary PCP. His labs, CD4, 100 cells per millimeter cube. His viral load, 200,000 copies per mil. Stool exam shows, well, Giardia, Lamblia, E. coli, Entamoeba histolytica, basically amoebiasis. He has aquamarine stain, showed moderate cryptosporidium. His VDRL is reactive 1 in 28, TPHA is reactive, and he has herpes. He's herpes positive. And his differential diagnosis, disseminated Mycobacterium avium complex, PCP, and cytomegalovirus. He has also E. coli, syphilis, herpes, Vibrio parahemolyticus, Yersinia species, rotavirus. All right, so let me see if I can do this. So
you go to appointment / patient monitoring.
Right.
View appointment. View pending appointments. And then we are going to use AND211 as the client.
Okay. So he's here.
Yes.
Purpose of appointment is HIV clinical care.
So you will now go back to the same place, appointments and patient monitoring. And do create visit.
Okay, so I've put in his unique ID and now I'm going to start the visit.
Yep, so you record his vitals. So right. we do not have vitals, we can assume one. The case doesn't have vitals, right?
No, it doesn't.
So you can assume a vital.
Now, do I have to go back and do I assume that is a paper that I don't know anything about him from the previous visit?
No,
he's in the system already.
He's in the system already, so you're just going straight to his file. Yeah.
Okay.
So the story is so that we don't go to previous encounter, but we already have him as an adherent client who is always brought in by the prison warden all the time. for
Okay.
his treatment. Yeah.
Mhm. So temperature, let's see what else he has so that we can have a realistic temperature. Okay, can put his temperature as normal. 98.6.
No, that's Celsius.
Oh, sorry.
Let's say 36.4. Nope. You convert this to convert to Fahrenheit. Yeah. So 36.4.
36.4. Blood pressure.
Pulse. Let's say something normal, 89, 68. Respiratory rate of 24. And then click on convert to Fahrenheit under the degree Celsius. No, yes,
That.
yeah.
Okay. Okay.
So his weight now, we don't have his weight, right? So we can assume he is 160 pounds.
Oh, sorry.
No, go back to pounds.
Oh, yeah, that's pounds. Okay, 150 pounds.
Then height, let's say he's 175 cm.
And the BMI is automatically calculated?
Yeah, go back to height in meter. Click on height in meter. No. Just no, not that. Yes, that's no.
Height in meters.
Click that.
Click this?
No, okay. Now you're in height in cm. Click inside of the box of height in cm. Right? Then move to the height in meter. Click in the box to recalculate. Click inside of the field of height in meter. So click, no, go in it and click it. Yes, that's good. Then
Oh,
go to BMI, click. Yep. So it
okay.
automatically calculates once you click. Then you scroll down and send. Okay. So now we'll go to clinical management on that pages. No.
Oh, sorry.
No.
Well, that's another visit. Yeah, that's okay. Clears automatically. Okay.
Yes, clinical management. And then HIV care card. The unique ID. And get forms. Okay, so we have all of the flags on the page, so you can scroll down. So scroll down. You have the vital signs that was recorded. Scroll down. Now you have all the tabs. So you can choose to repeat the vital sign or move straight to symptom review. The second tab. Okay.
Okay. So today he's
Loose stool, abdominal cramp.
it presents today with loose stool. Okay.
So he said he always has on and off fever and loss of appetite.
Says sweats.
Yes, sweat. So his weight today was 165 pounds. But let's assume he said he used to weigh 177 pounds. So she has lost 12 pounds. So weight
Okay.
loss. Malnutrition. Okay, so now you're going to go to detailed findings. So your own findings on physical exam. If you have additional, you put there. If not, detailed findings.
Okay, so I can make up stuff?
Yes. Yeah, you can make
Oh.
up stuff. Yeah.
Okay. Yeah. Now, should I have done perhaps I should have done so this temperature, etc. here would have been for today, correct? The vital signs.
Yes, the most recent.
Okay.
So let's assume that you repeated it.
Okay.
So the vital signs, let's say that's what the nurse registered when they
Okay.
planned, and then you are repeating it now.
Okay.
Yeah.
All right. Um, okay. Trying to see how sick I can make this person with cow.
Okay.
All right. So this person has, let's see. So should I make up these or because they're not given in the scenario?
Yes, you can make them up. No.
So, yeah, some thrush. Mm,
Scenario said he has herpes, so maybe you're suspecting that also.
mm,
The second one.
oh, well, this is herpes zoster though.
Okay. Oh, it's not the same here.
Yeah. Yeah, some sweat, some fever, weight loss, loss of appetite. So I'm going to suspect he has some kind of.
Well, fever is there, so we take fever.
It's fever. Oh yeah. Mm.
Yeah, cough and or shortness of breath. Right under fever.
Okay. He is in prison. Does he have access to condoms?
Ha! Big question.
Let's assume he has.
Big question.
Yeah. So patient's disposition is not applicable.
Assessment is symptomatic, opportunistic.
Yes.
Okay, so the plan is now to do a lab evaluation, screen. Well,
The person is the person was I didn't get all the details. Is the person HIV positive? No?
Yes, he has been positive and in care, and he's on ART.
Okay.
But the scenario
So we'll
says
need
that
post exposure.
yeah,
That is usually for females.
yeah, but the scenario says that he's on some medications,
he's
right?
on medication already. Yes.
Yes.
Are we sure that this whole symptom is not a side effect of one of those medications?
All of these symptoms?
Not all. Maybe let's say maybe the loose stool is not caused by the medication since he has been on it for long and only started having the symptoms. But maybe it's increased the frequency or made it worse. I don't know. So what medication was he on?
He's on, let me see, he's on metronidazole. He is on, no.
Isn't he on ARVs?
Yeah, ARVs.
Right. So
this
you
is
would
the
need
treatment.
anything else there, you would need adherence counseling.
Is it treatment? You have treatment and the plan. Is it what he's on right now? Let's see what he's on right now. He is only on ARVs right now.
Right. So I think we need to look at the adherence counseling.
Yeah, so the scenario says he's adherent.
He's adherent.
He's adherent. Okay.
Yeah. He might have some opportunistic infection and prophylaxis. Don't need to hospitalize him.
Symptomatic treatment. Something for the fever.
And I don't know about the prophylaxis. Let's see. He has
the prophylaxis is for to address any situation, any infectious situation. So I will go with the prophylaxis because
CD4 is 100. It's very low, right?
Yeah, it's low. But he needs some OI therapy too.
Yes, he needs
because he already seemed like he already has
a comorbid situation.
Yeah, he already has PCP and
HIV.
Yeah, and cryptosporidium. Okay. And some treatment for his pain.
So are you going to review his medication since he's going to be on metronidazole and there might be a drug interaction?
Yeah, I was looking for the drug-drug interaction online actually, but I can't find nelfinavir in the Liverpool system. But you're saying that nelfinavir would interact with.
Protease inhibitors. If you're going to change his medications, right? Metronidazole interacts clinically. It has a clinically significant drug-drug interaction with metronidazole. So if you want to review the ARV regimen and change that medication, you want to, in case if you are going to prescribe a protease inhibitor for him, then you know that there's a drug-drug interaction with the solution form and metronidazole.
So our options below. If he's HIV positive, we need to continue the treatment.
So are you continuing current treatment or you want to change treatment?
I want to
change.
Ongoing postpone clinical reasons, start new treatment, ongoing monitoring, ARV treatment not indicated, restart treatment. Well, the problem here is that he has been on medication since when?
2019.
And he has a CD4 of 100. No, he needs treatment change because obviously this is not working.
Yeah.
And he's adherent.
Yes.
What's this now? This is what I'm going to consider?
You can leave it blank or fill it in. If you're what you're going to consider, you can fill it in, or you want to leave it blank and type into the box and click on save.
Oh. But the thing is, I would like to do resistance testing.
Okay, so it's just save now, and then we'll move to that.
Okay.
So if you are going to order a drug resistance test, it is going to be on paper to the lab, and they're going to update the results, and you view the results here or above his form as a flag of the drug resistance test. So now you can move on to clinical staging or update the CD4 and viral load that you have there as the value.
Okay, so now it's 100.
Yes.
Yeah. Today is the 16th.
So you see how the next form came on the page after the save button. So that is like a display problem. And I'm going to fix that to make sure all devices are compatible later on. Okay. So you just ignore the form below and just save under there. No, not that save. The save above, below that. No, below the CD4 value.
Yeah. Okay.
Yeah.
So what you were saying, what was a display problem? This?
Seeing the next form, the treatment under there.
Oh, okay.
It's not coming from your system. I'm just going to update the compatibility later on.
Okay.
Yeah. So now you get the idea of the hands-on, right?
Yes.
Yeah. So you can choose to continue doing the mental health assessments and treatment. You can privately go back, register clients, have unique IDs, and practice over and over to see all the things so that you can have recommendations for the next training we'll have for clinical management. I think it should be the part 3 of clinical management should be on the 25th of February and 28th of February, either 25th or 28th. So at that time, if you have tried doing this, you have more recommendations, whatever you think should be there to make it better, you will find it, and I will keep updating as I get recommendations.
Okay.
Yeah. All right. Thank you so much.
Okay. You're welcome. Yeah.
Does anyone else want to try? Because we have just 13 people on the call, so I didn't want to do breakout rooms, so we can all just practice here and discuss. So if anybody else wants to try hands-on while we're here, let us do it. So thank you so much, Dr. Nisbet. This was an excellent trial for the first time.
Yeah, thanks.
Yeah.
Okay, how do I stop sharing now?
Go above and you see view options there.
I see pause, share, or more options here.
Yes, more options. Or I can stop it for you.
Okay. All right, thanks.
All right. So anybody who wants to try out with guidance, I'll give you a unique ID of a client and then you try to enter the record.
Okay, Mildred, I don't mind trying, but let us try and do this slowly
Okay.
and go step by step. I don't know if we have to start from the beginning. I guess it would be a long journey, but
okay. You can use the same unique ID, just create a new appointment like you are starting afresh. So you don't have to. So I just sent you the ID AND211.
AND
211.
211.
Yeah.
Okay, so where do I start? I go to share screen?
Yes, you share screen.
I see join conversation. Sure, okay.
No. You go to the site now, CBS4. Go up above your browser.
Training. Hold on. So how do I?
Yeah. You can open a new tab if you want. You click on the plus sign above there. After the zoom, you see a plus above. Can you see it? Okay. You have to double click it at the same time. Okay. So you scroll down. View pending. So you want to give a new appointment or you want to use this new one, AJ201. Just use the new one, AJ201.
Use
Which
one? The last one? This one?
Yes.
AJ2. Okay, I got that. So where I go from there?
So you go back
to pages.
Yeah, routine appointments.
You
scroll down. The appointments or patient monitoring. Then you schedule new clinical management appointments. Or check if she has an appointment already. I mean, appointments/patient monitoring. Click on that. Expand that, sorry.
This one?
Yes. Then in the list of options, look at view pending appointments to see if there's an appointment for that client. So the client has an appointment for today already. So you can now come down to create visit. So assuming this client did not have an appointment, you would have scheduled the appointment. So you scroll down to the same place, the patient appointment/patient monitoring. You scroll down and you go to create visit/record vital signs. Yes. Enter the unique ID.
And it will start visit?
Yes. Then you scroll down and record vital signs. So to make it easier for you, you might just want to make up anything as you go along instead of reading the case.
How do I get the BMI again?
So click on meter.
Click on me. Oh, okay.
Then go back to click on BMI.
Okay.
So this person is very tall, 2 meters tall.
Oh, fun.
The person is
Okay.
almost 12 feet tall. That is dangerous.
So we could change it. 150.
Yes.
Okay. Let's say 120.
Okay.
Okay.
Click on meter, it will convert. And then, yep. I click on BMI to recalculate.
Okay. That's better?
Yes, but this one is heavily obese.
Okay. And
send.
so you send.
Yes. And okay. Click on okay.
But
Okay.
this thing is, wait, this part, it has something here in front, my okay, so I need, okay.
Okay. Okay.
Okay, and then you go back to
pages,
and you go
clinical
down
management.
Clinical management.
And now you are getting HIV care card. Enter the unique ID. And get forms. And now you can scroll down. And then you can start from symptom review. Or you can, yeah.
Symptoms review, this, okay.
Yeah.
Is it again? 17, 16?
Extend, yeah.
Oh, sorry. Wait. Present complaint. Shortness
So,
of breath. Could we put that?
yes, anything you want, just make up the story now.
Something. SOB, irregular heartbeat. Anything else? Well, we know he's grossly overweight, so that's why I said shortness of breath and the irregular heartbeat. What else can we say here as it relates to his condition, HIV?
Diarrhea, frequent loose stool.
Yeah, okay. Could leave that there for now.
Okay. So go to the findings, detailed findings.
So findings, HIV positive, you could just put HIV positive or?
No, this is the client that has been in the system for long, right?
Oh, okay. So what are we gonna put here?
So what you on physical exam, let's say you check the heart, the lungs, the sound, you
you put what you do.
Yeah, what you do, the findings. Let's say
Vital sign.
Yeah, let's say distension, abdominal distension, or tender to touch, or something, anything.
Okay, okay. Swollen legs, maybe.
Yes.
Swollen legs and oral. Oh no.
Let's say oral
Fever.
thrush, fever. Yeah. Fever. Let's say he looks dehydrated, or let's assume he has jaundice.
Okay. Dehydrated. Opportunistic infection. We could put pneumonia maybe because you have a fever.
Okay, can put pneumonia. Fever, cough, shortness of breath. Cough and shortness
of breath. Okay. You're not hearing me? Sorry. And he's on the pill. Laugh out loud.
Hey, man. Okay, let's say he's not using any family planning method. So you just click the last one, not using any family planning method.
This one.
No, the
this
last
one.
No, the last.
No, oh, the last one. Okay.
Yeah. And the next is not applicable. Not applicable. The first one. Assessment.
Symptomatic.
Yep.
Does he have symptoms?
Yep. Opportunistic infections.
Okay, so we had to do some lab tests.
Okay.
Because he had, we did say because he have a fever, we could probably screen for TB.
Yes.
Symptom treatment. We could do this one, treat the symptoms.
Yes.
Yeah. Let me see where we go from there.
So if you want to fill in the ARV therapy that he's on, so let's assume scroll on under ARV therapy, select, let's say he's on, you are going to continue or change treatments. Let's say you want to
continue.
Okay.
Continue current treatment for now.
Okay. And then the current treatment he has is isoniazid. So click on that.
If he an isoniazid, well, we probably need to take out the screen for TB up here.
Okay, then take it out.
Because we have a screen for TB up here.
Okay.
Okay, so
isoniazid.
This.
Scroll down. You control and press the next one. Scroll down for ARV. So let's say he's on, which regimen do you want to put him on? AZT, 3TC.
This one.
Okay. All right. So you can fill in anything not on the list that is not ARV that you are prescribing in the box below, and then click Save.
This box?
Yes.
Okay, we want to give him some Panadols.
Okay.
Does he have a fever?
Okay.
It's obvious that he have. Do you have to say how we prescribing the Panadols, or just mention Panadols?
You can put how many he's taking. It's just for record purpose, so that the next person that reviews this will know what you did.
Oh Lord. Yeah, so I guess he have an infection, so we'll need to give him something for the infection, maybe. I don't know. I'm not really a doctor, so I don't know.
Okay. So you can leave it there and save.
Okay, leave it here and save. Let us give him some Septrin though.
Okay.
Maybe.
All right, Septrin.
400 milligram.
For 960 or 480. Is it 482 tablets or 960 once daily or twice daily?
Milligram.
Yeah, milligram.
OD.
Yep.
Times 1 month.
Let's say 1 month, 30 days. So times 1/52. 1/12, sorry. Okay. Save.
Why a month and not 2 weeks for the Septrin?
Go ahead.
I don't know, but I don't know how they prescribe Septrin, but I know that they give different times, 10 days, 2 weeks, 1 month. Some people for a long time.
People could be because I think it's because of HIV clients, and they could always pick up other infection. So depend on what they are presented with, you give them depending on their condition. So it could be a week, it could be 2 weeks, it could be a month. Sometimes it goes longer for that. So I guess it
could be ongoing. If it's prophylaxis, it could be ongoing for a long time.
Okay.
Yes, please. Not really in well, they could be on it for a while. Yeah, sometimes 2-3 months I get. A long time, depending on what is going on with them. Okay, Mildred, so where we go from here?
So because the client is on arts, right? And if you are prescribing new arts, you want to go to treatments.
Treatment. Okay.
The treatment tab. No, it's not there.
Treatment tab now here. I
No,
see
no.
no treatment. Oh, sorry.
The first and the last row. Yes.
Yeah.
So you move down. Scroll down. So now you want to enter it.
Here, right?
Yes. So the drug is CDF FTC EFB. So you're assuming that you are prescribing what he is currently on, but you want this for record purpose so that the next doctor will refill prescription on the same medication if he's not going to change medication. So so that is first line.
Okay. So what the CHA stands for?
The regimen, just choose, click on it.
Oh.
And first line.
Oh, okay.
So the dose is already there. I think the dose is 300. What's the dose there? It's 336, 300, 300, 600. Go back to
you have to write it in?
Yes.
Oh, 300. I guess it's 3 tablets in one, so they had different doses. So I can't remember how they go. 300 milligram.
300 milligram slash 3 or plus, 300, 300, 600. I hope
300,
I'm right.
300, 300.
600.
Okay. Duration, 1 month or 2 months?
So 1 month. So let's say he comes back every 30 days for now until when he's stable, then every 3 months.
Follow up in a month time.
So I think that dose was supposed to be 400, 300, 300.
400.
So click on the tablet. The tablet should have the amount on it. Go back to the first. Okay, yeah, so it's 300, 200, 600.
Okay.
362. 326, sorry.
Let me see if anything is in front of this here. Oh, okay. So it's 3.
200.
Oh, sorry. Erase them. So this one, it should have been 2.
2, yes.
Yes. And
Okay.
then 6 there already.
Yep.
Okay. So I was just saying, maybe we could write a follow-up in the next month.
Yes.
Oh, Lord. Wait,
It's okay.
Mildred,
It's okay. It's okay. It's okay.
It's okay? All
Yeah.
right. So save.
Yeah. Okay. 10. So every other thing on the form has need basis. If you have any information, you want to do mental health assessment, you want to record any drug reaction, you want to do a clinical staging, or you want to update CD4 and viral load results. So the rest are optional. What you just did now are the compulsory tabs that you need to fill on every clinic visit.
I just want to say it's a lot of information. It's very useful. But as one speaker said before, I think we will not really get the gist of it now until we started to do it.